There are a few things that you need to know when you start to use needle drivers to pick up the suture needle. First off, there's a difference between needle drivers and a hemostat. As you can see here on this hemostat, these lines here are all parallel and kind of horizontal, whereas on the needle drivers they're actually cross-hatched, and there's this little divot just in the middle there for some of them. So that's one of the differences there. And then also there's different lengths of the needle drivers based on what you're suturing. And then if you're doing something like central line insertion, the kits usually come with these needle drivers that are just smooth on there, and they work for that. If you don't have any needle drivers, you can get them online off Amazon, or you can use just a hemostat will actually hold the needle well enough to practice out of just like an instrument kit in the hospital. In this orientation, this is the forehand orientation. Usually you want to pick up the suture as close to the tip of the needle as pick up the needle as close to the tip of the needle driver as you can, and you want this angle between the suture needle and the needle driver to be about 90 degrees. Sometimes when you're throwing a stitch, it'll actually help you out if you angle it up a little bit more, so that this angle here is greater than 90 degrees. It'll help you reach a little bit better in some circumstances. But for the most part, 90 degrees will work just fine. Then the other thing to know is that when you're doing a backhanded stitch, you want to reverse the needle. There's a couple different ways to do this. You can pick it up with your, usually if you're suturing the skin, you'll want to ask for Adsons or power pads. That's because they have these teeth on the end, which is good for picking up skin without crushing it. And they also have these ridges right here so that you can grab the needle firmly. Whereas if you just have forceps without those ridges, it's going to be a little difficult. So you can go ahead and just regrasp here like this. Or another way to do it is actually, if I have it in backhand right here, you can actually just loosen up your grip. If you've got this clicked, you can actually loosen up your grip and then just gently rotate this around. And that'll move it from backhand to forehand. Then you're ready to throw your forehand stitch.